Are complementary and alternative therapies worth billions of pounds that we spend on them? And do they have the same effects as conventional medicine? The scientific community is split over whether they work. Acupuncture. What is it? Acupuncture is one of the oldest and most commonly used alternative therapies, originating in China more than 2,000 years ago. What is involved? Therapists stimulate pressure points throughout the body using needles. There are 2,000 pressure points which connect to 12 main and 8 secondary pathways, which are called meridians. What is the theory? Acupuncture is believed to regulate our spiritual, emotional, mental and physical balance, which is influenced by the opposing forces of yin and yang. When yin and yang are unbalanced, our qi, pronounced qi, a form of energy, becomes blocked. Western scientists have been unable to explain acupuncture since meridians do not correspond to either blood circulation or nerve pathways. No one understands fully how acupuncture works, but there is some evidence that stimulation of pressure points increases the flow of electromagnetic signals, which may trigger the release of the body's natural painkillers such as endorphins or immune cells. What is the evidence? Researchers at the University of Maryland, Baltimore, discovered that patients treated with acupuncture after dental surgery had less intense pain than patients who received a placebo. The same team has also shown that acupuncture can reduce the pain of osteoarthritis when used with conventional drugs to a greater degree than when these drugs are used on their own. Professor Ernst says there is good clinical evidence that acupuncture works for osteoarthritis, migraine, dental and back pain. But there is good evidence that it does not work for some treatments, such as weight loss and smoking. Reflexology. What is it? Reflexology is the therapeutic manipulation of the hands or feet, which, according to practitioners, have areas that correspond to parts of the body. What is involved? As well as manual manipulation by a qualified practitioner, it is now possible to buy reflexology guides and foot massages for do-it-yourself reflexology. What is the theory? The practitioner can diagnose the abnormalities by feeling the hands or feet. By massaging or pressing these areas, he stimulates the flow of energy, blood, nutrients and nerve impulses to the corresponding body zone and thereby relieves ailments in that area. What is the evidence? A study published in Respiratory Medicine last year described 40 asthma patients who were given 10 weeks of simulated reflexology and 10 weeks of real reflexology. The researchers, using both subjective tests and objective lung function tests, could find no evidence that the reflexology helped the patient's asthma. Practitioners claim that reflexology can cleanse the body of toxins, increase circulation, assist in weight loss and improve the health of organs. Dr. Barrett, Vice President of the National Council Against Health Fraud in the U.S. says, there is no scientific support for these assertions. Professor Ernst says, practitioners use reflexology as a diagnostic tool and it does not work. It can be relaxing though. Iridology. What is it? According to iridologists, the eye contains a complete map of every body part. This therapy was invented in the early 19th century by a Hungarian physician, Ignaz von Pexley, who, during his childhood, accidentally broke the leg of an owl and noticed a black stripe appear in the lower part of the owl's eye. What is involved? The practitioner looks into the patient's eye and checks the pupil's pigmentation against iridology diagrams. Several dozen configurations exist. Herbs are then prescribed to help the patient with their diagnosed illness. What is the theory? Iridologists believe that a person's health can be diagnosed from the color, texture, and location of pigment flecks in the eye. Some claim that the eye markings can reveal a complete history of past illnesses. What is the evidence? According to Dr. Barrett, there is no known mechanism by which body organs can be represented or transmit their health status to specific locations in the iris. Professor Ernst recently published a review of the scientific literature on iridology, but he could find only 4 studies that had been carried out according to correct scientific procedure. These studies suggest that iridology is not a valid diagnostic tool. Professor Ernst says firmly, patients and therapists should be discouraged from using this method. Chiropractic manipulation. What is it? Chiropractors diagnose and treat conditions that are due to mechanical faults in the joints, especially the spine. What does it involve? A chiropractor manipulates joints using the hands to improve mobility and relieve pain. What is the theory? If the spine is not functioning properly, it can cause irritation of the nerves that control posture and movements. This irritation can lead to referred pain, which is felt in another part of the body. By manipulating joints, chiropractors stimulate the joint's movement receptors, which are sensors that provide feedback to the brain on where the joint is. What is the evidence? Going to a chiropractor is now mainstream. The British Chiropractic Association reports 90,000 patients visits a week. It is one of the most regulated of the alternative therapies, and yet, of those discussed here, it is potentially the most dangerous. Manipulation of the neck can tear the fragile tissue of the vertebral artery and, in the worst cases, result in a stroke. In January this year, the UCLA Medical School published a report on 681 patients who were given chiropractic help when they had lower back pain. After 6 months, 96% of them still had lower back pain, leading the researchers to conclude that chiropractic manipulation had been ineffective. Professor Ernst says, the bottom line is that it works for a very limited number of spinal conditions and mainly in the short term.